Good day, class. So today we are going to tackle or discuss what is orthopedic impairment all about.
So at the end of the lesson, the students must be able to
A. Define what is orthopedic impairment.
B. Know the different categories of orthopedic impairment.
and C. Internalize the possible causes of orthopedic impairment. So let's begin the discussion by defining what is orthopedic impairment.
So what is orthopedic impairment? So orthopedic impairment means a severe orthopedic impairment that adversely affects a child's educational performance. So the term includes impairments caused by a congenital anomaly, impairments caused by disease. So example given of these are poliomyelitis and bone tuberculosis. And also impairments from other causes such as cerebral palsy, spina bifida, amputations, and fractures or burns that cause constructions.
So there are two main categories of orthopedic impairment, namely congenital and acquired orthopedic impairment. Congenital orthopedic impairment is defined as an orthopedic impairment that a child is born with and begins before birth. For example, a child may be born with joint deformities, spina bifida, or muscular dystrophy. Muscular dystrophy occurs when voluntary muscles progressively weaken and degenerate until they no longer function.
Acquired orthopedic impairment. So, acquired orthopedic impairment develops right after birth and can be caused by injury or diseases as well as trauma during birth. So, ang kaning acquired kay opposite siya sa congenital orthopedic impairment in which ang congenital kay naa na siya daan pagpanganak while kaning acquired kay na-experience niya through lifetime, so caused by accidents or kanang unsa nga panghitabo sa kinabuhi nga maka-result nga mahimo siyang orthopedic impaired person.
An orthopedic impairment can be either congenital or acquired and encompasses an array of characteristics. These characteristics can be grouped into three categories, which are neurological, musculoskeletal, and congenital malformation. So we will first discuss the first category of orthopedic impairment, which is neurological. So this type of impairment can be described as damage to or abnormality of the brain, nervous system, or spinal cord, which is responsible for sending neural impulses to muscles of the body, facilitating voluntary movement. In many cases, these types of impairments are congenital, but they can also be acquired at birth. Neuromotor impairments are often complex and affect several systems of the body, in addition to causing motor weaknesses. Examples of motor problems in this category include reduced movement of the limbs, spinal misalignment, and a loss of urinary management. The most common neuromotor impairments are spina bifida and cerebral palsy. So epilepsy is the most common orthopedic impairment, even though many do not consider this condition to be an orthopedic impairment at all. Epilepsy or a seizure disorder does cause significant orthopedic consequences. The root problem with the epilepsy is an abnormal discharge of electrical activity by one or more cells in the brain. This discharge disrupts the normal functioning of the brain, causing altered consciousness, unusual motor activity, hallucinations, and sometimes problem or inappropriate behaviors. Seizures can be managed through a number of interventions. Most often, the child will be given anticonvulsant medications. These medications seek to either prevent the initial abnormal discharge of electricity in the brain or prevent the seizure from spreading to adjacent cells. Second type of neurologic condition, one that is becoming alarmingly more prevalent in the U.S. and other industrialized nations, is traumatic brain injury or TBI. Traumatic brain injuries are often acquired injuries occurring after birth and throughout the lifespan. TBI has many causes, most of which we directly control. The accident or injury that produces the TBI produces both primary and secondary injuries. While this often vary by the extent of the injury and by the person's pre-injury personality, this is felt to be the major variable in recovery rates. Certain general outcomes occur in many instances. Cerebral palsy is a non-progressive disorder of the central nervous system. This includes the brain and the spinal column that is a result of an injury to the developing brain. The injury causes a palsy, muscle weakness, or paralysis that affects a child's abilities to regulate muscle tone, initiate movement, and maintain their posture. The degree of severity and the effect on the motor skills of the child depends on the specific area of brain injury and the extent of the damage. The injury or damage associated with cerebral palsy can occur prior to birth, during birth, or after birth, and can have many causes, although in most cases the cause is unknown. Cerebral palsy is a non-progressive disorder, meaning that initial damage to the brain does not become worse. You should note, however, that some of the associated or secondary conditions, such as contractions in the joints, curvature of the spine, and possibly seizure disorders, may worsen over time. The degree of cerebral palsy will vary across persons, types, and the limbs involved. No two persons with cerebral palsy are the same. In many cases, the person with cerebral palsy will experience other associated disabilities. Poliomyelitis, more commonly known as polio, is caused by the poliovirus. Polio can spread from person to person and is known to infect the spinal cord, which causes paralysis. Poliovirus can not only cause paralysis of an arm or leg, but it can also paralyze the diaphragm and muscles required for breathing. Is polio contagious? Yes, polio is highly contagious. It spreads easily from person to person. How does polio spread? Polio spreads through coughing or sneezing or from coming in contact with poop or an infected person, which what we call as fecal oral route. It can spread by not washing your hands after going to the bathroom or touching poop like changing diapers, drinking contaminated water, or getting it in your mouth. Eating foods that have touched contaminated water, swimming in contaminated water. Water can become contaminated when someone who has diarrhea swims in it, coughing or sneezing, being in close contact with someone with polio, touching contaminated surfaces. So how is polio treated? There are no specific medications to treat polio. If you have paralytic polio, receive physical therapy. If your breathing muscles are weakened or paralyzed, you'll need mechanical ventilation. It is a machine that helps you breathe. The best way to prevent polio is to get vaccinated. Vaccination is usually done in childhood. If you didn't get vaccinated as a child or don't know if you did, ask your healthcare provider if you should get vaccinated. Spinal cord injuries occur when the spinal cord is severely damaged or severed, usually resulting in partial or extensive paralysis. Spinal cord injuries are most commonly a result of an automobile or other vehicle accident. The characteristics and needs of individuals with spinal cord injuries are often similar to those with cerebral palsy. The term spina bifida comes from the Latin split spine, which is actually a birth defect where the tissue on the left and right side of the back that normally comes over the spinal cord to protect it don't completely meet up to form an eye seal, leaving behind various degrees of an opening right down the middle of the lower back. There are three main types of spina bifida. The first one is spina bifida occulta or SBO. This is the most common and mildest form of the defect. Many people don't even know they have it, so occulta means hidden in Latin. Here, the spinal cord and nerves are usually fine, but there might be a small gap in the spine. The second one is meningocele. This rare type of spina bifida happens when a sac of spinal fluid, but not the spinal cord, pushes through an opening in the baby's back. Some people have few or no symptoms, while others have problems with their bladder and bowels. Myelomeningocele, this is the most severe type of spina bifida. Here, the baby's spinal canal is open in one or several places in the lower or middle back, and a sac of fluid pokes out. This sac also holds part of the spinal cord, and the nerves and those parts get damaged. With myelomeningocele, there's usually no skin covering, and the spinal cord tissue is out in the open. No one knows for sure what causes spina bifida. Scientists think it may be a combination of the environment and family history or a lack of folic acid, a type of vitamin B in the mother's body. Studies have shown that taking a multivitamin with folic acid can prevent spina bifida and lower your baby's odds of having this and other birth defects.
Another category of orthopedic impairment is the musculoskeletal disorders. This category of orthopedic impairment encompasses several conditions which can all cause a wide-ranging degrees of limitations and restrictions of movement. So musculoskeletal disorders can affect the joints, bones, muscles, and tendons. So these afflictions can be congenital or acquired later in life, and examples include the diseases are osteoarthritis, rheumatoid arthritis, osteoporosis, and limb deficiency. These are the several conditions which can all cause a wide-ranging degrees of limitations and restrictions of movements. The first one is muscular dystrophy, or MD. So muscular dystrophy refers to a group of more than 30 genetic diseases that cause progressive weakness and degeneration of skeletal muscles used during voluntary movement. And these disorders vary in age of onset, severity, and pattern of affective muscles. The second one is juvenile rheumatoid. Juvenile rheumatoid is a form of arthritis in children ages 16 or younger. It causes joint inflammation and stiffness for more than 6 weeks. This disease may affect a few joints or many joints. It may cause symptoms all over the body. The most common symptoms include swollen, stiff, warm, red, and painful joints. The next one is the polyarticular GIA. So polyarticular GIA is an autoimmune disease. This means that the body's immune system, which normally attacks germs, mistakenly attacks the joints. This causes inflammation in the joints and other problems. The next one is arthrogryposis. So arthrogryposis involves a variety of non-progressive conditions that are characterized by multiple joint contractures or stiffness and involves muscle weakness found throughout the body at birth. The next one is osteogenesis imperfecta, or the OI. Osteogenesis imperfecta is a genetic heritable disease in which bones fracture easily, often with no obvious cause of minimal injury. OI is also known as brittle bone disease, and the symptoms can range from mild with only a few fractures to severe with many medical complications. The next one is the clubfoot. So, clubfoot is a deformity in which an infant's foot is turned inward, often so severely that the bottom of the foot faces sideways or even upward. The next one is the hip dysplasia. Hip dysplasia occurs when the hip joint has not developed properly and the socket is too shallow. This allows that the ball to slip partially or completely out of the joint. Hip dysplasia ranges from a mild abnormality to a complete dislocation of the hip. And the leg calf Perthes disease, or also known as Perthes disease, is a rare condition in which the ball-shaped head of the thigh bone temporarily loses its blood supply. As a result, the head of the thigh bone collapses and the area becomes inflamed and irritated.
So the third subcategories of orthopedic impairment is the congenital malformation. So what is congenital malformation? Congenital malformation is the alterations in the structure and function of the organ systems of a newborn that occurs in intrauterine life and is identified before, at, or later after birth. So in congenital malformation, we have limb malformation and limb deficiency. So we have here the limb malformation. So the limb is another name for arm and legs. So kids with limb deformities have differences in the way their arm or legs are shaped. For example, their legs may be curved, or one might be shorter than the other, or a bone in the arm may be short or missing. And the last one is the limb deficiency. Limb deficiency is when a child has a missing part of or all of a leg, arm, hand, or foot. Limb deficiency can be congenital, present at birth, or acquired the result of disease, an accident, or other trauma. So limb deficiencies can affect the whole limb or just part of the limb. So there are many potential causes of orthopedic impairment. So the first one is amputation. So amputation is the removal of limb by trauma, medical illness, or surgery. So as a surgical measure, it is used to control pain or disease process and affected limb such as malignancy or gangrene. And the second one is birth trauma. Birth trauma is a distress experienced by a mother during or after giving birth. While trauma can be physical, it is often emotional and psychological. So birth trauma is not just about what happened during the labor and the birth. It can also refer to how you, as a mother, are left feeling afterwards. And the next one is burns. So burns are tissue damage that results from heat, overexposure to the sun, or other adjacent or chemical and electrical contact. Burns can be minor medical problems or life-threatening emergencies. So the treatment of burns depends on the location and severity of the damage. And the next one is cerebral palsy. Cerebral palsy refers to the cerebrum or part of the brain that is affected, while palsy refers to a brain injury causing movement disorders. So in overall, cerebral palsy is a disorder that affects a person's ability to move, maintain balance and posture, just like what you see in the picture given above. The next one is poliomyelitis. Poliomyelitis is an illness caused by a virus that mainly affects the nerves in the spinal cord or brainstem. And also, poliomyelitis is a disabling and life-threatening disease caused by a poliovirus. The next one is bone tuberculosis. So bone tuberculosis is, or what we call osteoarticular tuberculosis, is a type of extrapulmonary tuberculosis. It is most often affects the spine, but it can also spread to other bones and joints. The next one is fracture. A fracture is a break usually in a bone. If the broken bone punctures the skin, it is called an open or compound fracture. Fractures commonly happen because of car accidents, falls, or sports injuries. Other causes are low bone density and osteoporosis, which cause weakening of the bones. And the next one is genetic disorder. Genetic disorder is a category of disease that includes certain types of birth defects, chronic diseases, developmental problems, and sensory deficits that are inherited from one or both of our parents. And the last potential causes of an orthopedic impairment is an injury. So an injury is a term comprising such conditions such as wounds, sprains, strains, dislocations, contusions, and compressions. So in addition, it includes conditions resulting from extreme of temperature.
Just as each student who is cognitively affected by a learning disability that varies in the range and depth of their disability, students with orthopedic impairments vary widely as well. For most students with orthopedic impairments, the impact on learning is focused on accommodations necessary for students to have an access to academic instruction. These are the needs of orthopedic impaired students. Teachers should organize like sports, painting, and drawing. So it is the goal of the teacher to organize her students, especially kung na siya estudyante nga orthopedic impairment. And teachers must ascertain that the limb or braces provided is functional and appropriate for effective use. So dapat sad siguraduon sa teacher nga ang gigabit sa bata kay effective o wala siya complications nga makasamo sa giagian sa bata. Teachers should also organize cooperative learning atmosphere in the classroom to minimize the social problems created by regular people. As with most students with disabilities, the classroom accommodations for students with orthopedic impairments will vary dependent on the individual needs of the student. Since many students with orthopedic impairments have no cognitive impairments, the general educator and special educator should collaborate to include the students in the general curriculum as much as possible. So, maong teachers should organize cooperative learning atmosphere labi na kauban ang regular student o ang student na orthopedic impairment. A short ramp-on test, removal of desk to make a room for the wheelchair to move. So it is important jud nga dako og space ang classroom para sa ani nga mga bata nga orthopedic impairment, and modification of furniture to provide for the comfort of the child with braces, and rubber mats on slippery sections of the floor in the classroom. So dapat jud kanang dili siya dangog karon dili mabuna lang bata ug maka-complicate na hinoon sa iyahang impairment, and wide doorways, handrails, especially na non-skid floor na kinahanglan jud sa bata nga nay orthopedic impairment, and rounded corners. Aning rounded corners, this is very important kay if pointed man gud nay possibility nga ang bata if dili siya ka-control sa iyang movement, mabangga siya sa aning mga pointed corners, masakitan siya. So it is useful nga rounded corners ang iyang gamiton. Ang providing footrest, adjusting seats to turn sides so that the child with braces can sit more easily. So dapat sad ang gilingkuran sa patay lang sitting arrangement dako siya space para maka-move siya freely, not in a way nga maka-move siya nga makakiat, but para sa nga maka-access gani siya og tarong haron komportable sa siya sa siyang gilingkuran.
So, students with orthopedic impairment will have different physical challenges and therefore require different accommodations. So, below are some specific concerns and challenges that children with orthopedic impairments may face. So, the first one is behavioral. Teachers in all subject areas should be aware of the impact of an orthopedic disability on a student's behavior in class. So, students with this impairment, for example, might get tired more quickly than their other peers without orthopedic impairment. So the second one is participation. Physical education in particular may pose different difficulties. So some students with orthopedic impairment will need to be excused from gym class. Other students with mild orthopedic impairment may be able to participate. The third one is setting. A student may need special seating arrangements to help him with posture and mobility, as moving around the classroom or moving around school hallways may be difficult. So schools may also need to arrange the schedules of the students in a way that prevents them from having to travel long distance from one class to another. So providing elevator access may also help. And the fourth one is technology. They may also need assistive technology devices to help them communicate or lessons that address their disability, such as those that will help them improve their gross and fine motor skills. So devices and technologies that might be utilized may include wheelchairs, specialized desks, canes, crutches, communication software, or space recognition software. And the last but not the least is travel. Children with orthopedic impairments may also face challenges accessing transportation to get to and from school. So, federal law, however, requires school districts to provide the transportation necessary to help children with disabilities travel to and from school. So, that's the end of our topic. I hope you learned something all about orthopedic impairment, the categories and the subcategories of this. That will be all. Thank you.